Congress is getting ready to cut Medicaid and Medicare. And President Trump has indicated that he does not want to touch both Medicare and Medicaid. But at the same time, he has supported a Republican plan to just do that. This is not a drill. This is happening unless enough people push back on a devastating plan that House Republicans have that is right now in motion and has passed the House of Representatives and is headed to the Senate that will gut Medicaid and Medicare. Now, I know this may sound surprising to a lot of you, so I want you to stay with me. Let me go through all the evidence, and then you can go into the comments and let me know what you think, because this is happening and this is not a joke. And I want you to wait until the end because you may have heard a lot of complaints about what's happening in the Social Security Administration. There's breaking news today. A disruptive effect how slashing staff at the Social Security Administration is sparking fears the system could collapse. That's a CNN headline. And then I have another breaking news I want to talk to you about. This is regarding Social Security overpayments. And here's the thing. Overpayments affect millions of people each year, and the Social Security Administration now wants to claw back 100%. How do you know you owe Social Security money? I am going to tell you in a second. Now, if you're new to this channel, hit the like button, hit the subscribe button. We appreciate your support because all we do here is bring you the latest news and update, anything in and out of Congress that's going to affect your Social Security, Medicare, Medicaid, food stamps, and more. Now, as usual, I want to know where you're watching this broadcast from. So hit me in the comments. Let me know your city and state because we like to know where you guys are watching us from. Now, let's dive into this important news update. So the first thing is that millions are going to lose Medicare and Medicaid. That is a fact. And let me walk you through what's happening. So Republicans put up a budget proposal that's going to cut $880 billion from the Energy and Commerce Committee. That is a committee in Congress that oversees Medicare and Medicaid. And then the Congressional Budget Office came out and says Republicans cannot meet their budget target without cutting Medicare or Medicaid. So the House GOP has ordered the Energy and Commerce Committee, which oversees Medicare and Medicaid, to cut $880 billion in a bill that advances President Trump's agenda. This is something Trump is supporting. And so the Congressional Budget Office came and said, well, the numbers don't add up. The bookkeeper says that there is no way they're going to cut $1.5 trillion from the budget without cutting Medicare or Medicaid. And this is also reported in many news organizations have come out and reported the same thing. But here's the thing. The president is supporting this budget. So he has gone on record as saying he doesn't want to cut Medicare and Medicaid, but the budget proposal that he is supporting is going to do just that. So let's walk through it. Now, the New York Times came up with a devastating report about what's happening in Congress. This graph explained everything you need to know to understand that your Medicare and Medicaid benefits are at risk and they're going to be cut. Why? Okay, so the graph you're seeing, the Energy and Commerce Committee is a committee in Congress that oversees Medicare and Medicaid. And all the boxes you see, each box represent $25 billion over 10 years. So this is about $25 trillion that the Energy and Commerce Committee oversees. As you can see, Medicare and Medicaid is about 93% of what that committee oversees. So when the Republicans tell the Energy and Commerce Committee to cut $800 billion, and 93% of what the committee oversees in terms of money is Medicare and Medicaid, where is the money going to come from? The other boxes that you see, it's about like 3 boxes. That represents other things, other non-health things on the committee. So if they're going to cut $880 billion, which represents 3.5 full boxes, the thing that you see in red, where is the money going to come from? Because even if they cut all the other things, they're not going to get enough money to do that. And they're not going to cut all the other things. So let's talk about it in detail. 68 million dollars Americans are enrolled in Medicare, and 1 in 5 rely on Medicaid to afford Medicare. So when I say a cut to Medicaid is a cut to Medicare, there is a reason for that. I'm going to explain all that to you. Stay with me. I'm going to show you all the receipts, and then you can go in the comments and say whatever you want, because when this comes up, a lot of you don't believe that they will cut Medicare or Medicaid. And I'm telling you, the evidence is overwhelming. They're going to do it. 68% of Americans rely or are enrolled in Medicare, and 1 in 5 people who are on Medicaid also are on Medicare. With 12 million Medicare enrollees could not access the care if they cancel Medicaid, it's going to cause a lot of trouble for Medicare recipients. Why? Because there's 12 million Medicare recipients that rely on Medicaid to pay for their Medicare premiums. Nearly 30% of all Medicaid dollars directly support Medicare enrollees. So here's the part that a lot of people don't know. When we talk about Medicare, a lot of people on Medicare say, oh, that doesn't affect me. Well, guess what? 30% of all the money that is spent on Medicaid goes to support people who are on Medicare. So the fact that they want to take $880 billion in Medicaid means that they're going to cut Medicare. How is that possible? Well, the math does not add up. The Congressional Budget Office has confirmed Republicans cannot meet their $880 billion cutting target without touching Medicaid or Medicare. When the Medicare is set aside, let's say that we set aside Medicare, the total funding under the Energy and Commerce Committee is $8.8 trillion over 10 years. Medicaid accounts for $8.2 trillion of that amount, or 93% of the remaining funds under the committee's oversight. So let's do the math for a second. If they say they're not going to touch Medicare at all, then the money that is left is $8.8 trillion that the committee oversees. Out of that 8.8 trillion, 8.2 trillion is for Medicaid. So when both Medicare and Medicaid are excluded from what the committee is in charge of, they only oversee $581 billion in spending. So even if everything else that they oversee, if they cut all that, they're still not going to meet their $880 billion target. So mathematically, it is impossible for them to tell you they're not going to cut Medicaid or Medicare when they don't even have enough money to play with if they take out Medicare and Medicaid. This is simple math. So how does this affect you? How does cutting Medicaid affect Medicare? Well, the Justice in Aging and Medicare Rights Organization came up with a chart. This is what caught my attention to dig into this story today, and I have some interesting data to share with you. So, Medicaid covers Medicare premiums for 1 in 6 Medicare enrollees, providing relief from the $185 monthly Part B premium for over 10 million seniors and people with disabilities. Medicaid covers Medicare coinsurance, co-pays, and deductible, ensuring that 8 million Medicare enrollees living near or below poverty can access the care they need. So if you got Medicaid, it means that 10 million people who rely on Medicaid to pay for their Medicare premiums are going to be kicked off Medicare. Because if you're on Medicare and you don't pay your premium, you're going to be kicked off. And so they can tell you all they want that they're not going to touch Medicare, but they're going backdoor and kicking people off Medicaid. And that is how they're going to kick you off Medicare, because 12 million people depend on Medicaid to pay for their Medicare premiums. Most of them are seniors. They're dual eligible. So if Medicaid is paying your $185 Part B premium every month, and all of a sudden that is cut, then you're knocked off Medicare. It doesn't matter what the president says. It doesn't matter what the Republicans say with their mouth. They are speaking from both sides of their mouths. Premium assistance from Medicaid increases the effective income of low-income seniors by 10 to 20%, allowing them to afford other basic necessities. So here's an example to illustrate all of this. Like 81-year-old Carrie from Mansfield, Ohio, who could not afford to enroll in Medicare and receive medical care after getting Medicaid assistance. So there are seniors who reach age 65 and cannot afford to enroll in Medicare because they cannot afford to pay the Part B premium, the $185. The check, the Social Security check they get is so small that to take $185 out of it, they're not going to have enough money left to live off of. So they cannot afford it. So they rely on Medicaid to then pay for their premiums and then their out-of-pocket costs, their co-pays, and their deductibles. So by gutting Medicaid, you are going to impact a lot of seniors. And this is the lady we're talking about. Medicaid's coverage of Medicare premiums and out-of-pocket costs was life-changing for Carrie, an 81-year-old living in Mansfield, Ohio. Carrie had delayed enrolling in Medicare Part B because she was working and later hesitated to enroll because she feared having to pay late enrollment penalties. She was going without needed medical care and was hardly able to pay for her prescription drugs. After an area agency on aging helped her enroll in Medicaid and get financial assistance with her prescription drugs, Carrie was able to afford to enroll in Medicare. Thanks to Medicaid, she could finally see her doctor, fill her prescriptions, and have enough money for basic things like utilities and groceries. This is a real person that Medicaid helped afford Medicare. Now, a lot of people will tell you that, oh, private insurance, maybe they should just privatize everything and knock everybody off and privatize Medicare and privatize Medicaid and make it a private insurance. Well, this is a graph from the reputable Kaiser Family Foundation that is looking at the cumulated increase in cost for private insurance, Medicare, and Medicaid. And while all of these insurance have gone up since 2007, you can see that since 2007, private insurance has gone up by 104% compared to Medicare and Medicaid insurance that have gone up by 63%. So if what Elon Musk is doing is to break the system so that they can finally privatize Medicare and Medicaid, this is what you are going to see. Cost is going to rise, and a lot of people who cannot currently afford Medicare because they need Medicaid to afford it are now going to be in worse position because private insurance cost is rising faster than Medicare and Medicaid costs. What is the real impact? For example, in the state of North Carolina, there are 2.2 million people on Social Security and 2.6 million people on Medicaid. Think about that. There are more people on Medicaid in that state that are on Social Security. Medicaid is everywhere. And the fact that they want to gut it is going to impact a lot of people. Let's look at congressional districts. A lot of Republicans in Congress have voted for this plan to gut Medicaid. But let's look at some of their districts. Even the Speaker of the House, Mike Johnson. This is a share of adults under 65 with Medicaid in certain congressional districts. If you can see, Mike Johnson's district, 24% of the people in his district are on Medicaid. In California, Congressman David Valadao, 38%. Harold Rogers, Kentucky 5 district, 30%. These are high Medicaid districts, but they all voted to gut the program. And so the point is that this thing is happening, and they're going to tell you that they are not touching Medicaid and Medicare, but the math does not add up. So what else does Medicaid support? Medicaid is the primary payer for home and community-based services that allow Medicare beneficiaries to age in place with dignity. So if you want to stay in your home, you don't want to go to a facility, and you need a home aide or a home care person to come and assist you with basic needs, and you cannot afford it, guess what paid for it? Medicare does not pay you to do that. Medicare will not cover that. It is Medicaid, if you're low income, that will pay for a home health aide to come and take care of you. Long-term care, which is a huge area that Medicaid supports. While Medicare covers only short-term skilled nursing facility stays, Medicaid covers the majority of long-term stays, with more than 6 in 10 nursing home facilities relying on Medicaid. You heard that right. If you take 10 people in nursing homes right now, today, March the 9th, 2025, if you take 10 people in nursing homes, 6 of them are paid for by Medicaid. So when you got $880 billion from the program, you are going to hurt seniors. There is no doubt about it. Medicaid covers critical services Medicare does not cover, including transportation to medical appointments, specialized medical equipment, dental, vision, and hearing for low-income families. And then, here's another one. Medicaid provides critical funding to hospitals and healthcare providers, particularly in rural areas, ensuring all Medicare enrollees have access to necessary care. So, let's look at the budget. The House has passed a budget resolution requiring the Energy and Commerce Committee to cut $880 billion over 10 years. President Trump has stated, Medicare, Medicaid, none of that stuff is going to be touched. Well, the math does not math, because there is no way that is true if they want to take $880 billion from the budget. So one of the Congress people's Democratic congressmen said, this letter from the CBO confirms that what we've been saying all along, the math doesn't work without devastating cuts to Medicaid. Studies show Medicaid enrollees across the political spectrum value their coverage and cannot go without it, making cuts politically dangerous. So we're coming back to this. I was telling you, those 3 boxes, the one in red, 3.5, it's what they need to cut from all the boxes that you see. And it is impossible to do without touching Medicare and Medicaid. Impossible. So if they are not going to cut Medicare or Medicaid, what are the options? Let's walk through it before you guys go in the comments and come at me. Let's walk it logically, because we're going to use this box, and then we're going to figure out if they're not going to cut Medicare and Medicaid, what is left for them to cut. So the first one is Republicans face an even tighter political bind with Medicare than Medicaid, as President Trump has repeatedly pledged not to cut Medicaid. During last year's State of the Union address, President Biden said he wasn't going to cut Medicare and Medicaid and Social Security, and got a standing ovation. Voters do not want it to cut. So cutting Medicare will constitute a clear violation of a campaign promise. So if the president says he's not going to cut Medicare, and we're going to take him at his word, and we take that off the table, then what is left? Well, let's cut everything else that the Commerce and Energy Committee is responsible for. Even if the committee cuts everything that they are responsible for to zero, it will still be more than $600 billion short of the $880 billion target. Did you hear that? Everything that the Energy and Commerce Committee is responsible for, if they cut all of that to zero, which they're probably not going to do because other programs are also important, if they reduce all that to zero, they're still going to have $600 billion short. So the question is, where are they going to get it from? Well, there are some options. The committee could save around $200 billion by eliminating the Children's Health Insurance Program. But that option has not been raised by the Republican leadership. Even combining the total elimination of non-health care, if they cut everything else and they cut the Children's Health Insurance Program, they are still $400 billion short. So as you can see, it's not workable. What if they try other things? Well, they can do some things on the margins. They can overturn regulations that require car makers to make fuel-efficient cars. That would save $110 billion. They can auction telecommunication airwave, but the Defense Department does not want to do that. That would bring $70 billion. They can speed up permitting energy extraction. That could save $7 billion. So that's not a lot of money. Even if all these creative options are implemented, they will only generate $187 billion, far short of the $880 billion target. So we're left with cutting Medicaid. Congressional leaders have been signaling that Medicaid has been the main focus for the cuts, despite public statements to the contrary. Matt Godwin of the Committee for Responsible Federal Budget says $880 billion is a lot of money, and even if only $600 billion is coming from healthcare, you have to go beyond tiny tinkering on the margins to get it. So the bottom line is that the math indicates that significant cuts to Medicaid are the only realistic way for them to get to $880 billion, and there is no doubt about it. So Medicaid is the thing that holds Medicare together for a lot of people. And if they're going to cut it, it's definitely going to impact Medicare, because Medicaid prevents hospitalization and poor health outcomes for a lot of people on Medicare. And Medicaid provide critical funding to hospitals and healthcare facilities that all patients, including Medicare recipients, depend on. So what can you do about this? Well, you need to make your voices heard, because if they got it, it's going to have a lot of effects on people. And so call your congressperson, let them know that cutting Medicaid is not okay. And they can tell you they're not going to do that, but it's impossible for them to do what they plan to do without touching Medicare or Medicaid. So I want to hear from you in the comments. Let me know what you think, because this is a critical issue that's happening and a lot of people are ignoring it, but it's going to have a devastating impact on healthcare in this country if this goes ahead. So let me know in the comments. I've presented you all the evidence. So let me know what you think in the comments. Let's talk about Social Security and all the chaos that is happening in the Social Security Administration. But before we do that, let's talk about Medicare for a second. 90% of all seniors are in the wrong Medicare plan. And I've been hearing from a lot of you about your frustrations with your Medicare Advantage plan. And so we have partnered with Chapter Medicare, and they can help you find the best Medicare plan that is suitable for your budget and your needs. There is a window, there's a small window right now. It ends at March 31st, where you can switch into a better Medicare Advantage plan. Chapter is the real deal. They are the only organization with access to all 24,000 Medicare Advantage plans. They can see all of it, and their agents do not work for commission. They are not there to sell you the most expensive plan. They are there to sell you the plan that meets your need. And they can save you up to $1,100 a year. So call the number on the screen or go into the description to this video, and there's a link. You can fill out a form, and Chapter will be able to get you into a better Medicare plan. Call now, because, as I said, you have until March 31st to be able to switch. Then you have to wait all the way until the fall. So let's talk about Social Security. This is breaking news from CNN. A disruptive effect, how slashing staff at the Social Security Administration is sparking fears that the system could collapse. And then on top of that, there is news about Social Security overpayment. So what does this mean for you? Well, Social Security overpayment is what happens when you have been paid more money than you're eligible for. It typically happens with people who are taking Social Security before their full retirement age, and they're also working. And so when you're working and you're under your full retirement age, you're supposed to be reporting your earnings. And if you go above a certain threshold, they're supposed to reduce your benefits. But either because of staffing shortages or because of lack of adequate reporting, some people don't report all their income to the Social Security Administration. And then years later, they are hit with a check that they have to pay back. And it's called overpayment. And they will stop your Social Security benefits and use all that money to pay back the money you owe. And so the Social Security Administration has come out and said they're going to go after the millions of people who owe money due to overpayment and are going to collect 100% of it. So I'm going to do a whole video in the next couple of days explaining all of this and giving you details on what you need to do. But let's talk about Elon Musk and what's happening with the chaos that could affect your Social Security check. So, this is Arizona Senator Ruben Galago, and he put out something on Twitter that caught my eye. He said, "Are we seriously going to take the money seniors use for housing, food, prescription to survive just to give guys like Elon a massive tax break?" And so the senator then puts out a report, a few slides that says, "Be prepared. Here's what you can do if Elon Musk causes issues with your Social Security check." And then he gives an email for people in Arizona to email him. But this right here was what got me onto all this research that I'm about to share with you. Because this is what the senator posted. Doge is driving Social Security cuts that will make mistakes, acting head privately says. So the acting head of the Social Security Administration is privately saying this. The Social Security Administration acting commissioner said members of the Elon Musk cost-cutting team are outsiders who are unfamiliar with the nuances of the agency's program. So the senator is saying delays and issues at the Social Security Administration are already causing interruptions that are hurting seniors across the country. So how can you be ready? Well, here is what he's advising. Number one, monitor your Social Security account online. And here's the disturbing part. Explore local aid programs. He's telling you that things may get so serious or so worse that you have to go to food banks and community centers to find help in your city or in your county because there may be disruptions to Social Security. Reach out early. Contact Social Security early, as employee cuts may cause phone backlogs and delays in assistance, and then plan ahead. If possible, save as much as you can for rent, food, medical needs in case of delays. This is a U.S. senator from a state in Arizona that is telling you that you should prepare for Social Security disruptions. I would take it very seriously. Why is this happening? Well, Elon Musk has gone on record to say Social Security is a Ponzi scheme, and he doesn't think that the system can survive. In my personal opinion, this is just my opinion, I think this is all happening because he wants to break the system and then claim that the system is not working, and then they can privatize Social Security. Now, that's what makes sense to me, because Social Security has not missed a payment in 80 years. So all of a sudden, something that has not missed a payment in 80 years, he is calling a Ponzi scheme. And that drew a rebuke from Bernie Sanders, who says Elon Musk says Social Security is a Ponzi scheme. Is the opposite. Musk's agenda is to sow distrust or mistrust about Social Security so that they can do unpopular cuts to it. That's what Bernie Sanders thinks. But then the former Social Security commissioner, the immediate former commissioner, went further and said that Elon Musk and his team are breaking things so much that he thinks there's going to be delays in Social Security payments in the next 30 to 90 days. So what is happening? Well, they've started laying off people. They're laying off 7,000 people at a time when Social Security staffing is at an all-time low. Record number of people are receiving Social Security benefits. At the same time, staffing at the Social Security Agency is at a record low. So they're closing regional offices. They're kicking up leadership teams. And so this is going to have some effect. And it's going to impact retirees. So it means that if you call, it's going to take time. Somebody commented yesterday from California that they were on the phone with Social Security during the week for 3 hours, and then they gave up and hung up. That is the future, because an agency that has more people than ever getting benefits, but at a record low with staffing, and they're about to cut 7,000 more people, that is going to have an effect. They're closing offices, local offices, and then they are tinkering with the technology. It would not be surprising if something breaks. And if you are applying for Social Security, you have to apply early because benefits are going to be processed, but they're going to be processed in a time frame that is not going to be conducive for you. So as soon as you're eligible and it's your intention to apply, you should apply early because typically it takes 4 months to process. It may take more. The websites may have issues. There may be documentation delay. If you need to go to the Social Security Administration and ask for a documentation and a human has to process it, well, with less people working there, it's going to cause further delay. And so that is something that you need to pay attention to. And then the series of cuts are going to hit people with disability even further. And here is a data point that I want you to think about. 30,000 people each year die while waiting for their disability appeal process to go through. 30,000 people die each year waiting for their disability application to be approved because it takes about 18 months to 2 years to go through the Social Security disability process. And now that they are cutting more staff, well, these are the same staff that is needed to process Social Security disability applications. So what do you think is going to happen? It's going to mean that more people are going to be hurt. More people are going to die waiting for their Social Security disability application to go through, because here is what a lot of people don't know. Only 30% of disability applications are approved on the first try. The other 70%, if they think that their application was denied unfairly, they have to go to an appeal process. And there's a 3-step appeal process. And that can take 2 years to go through. So, record low staffing, record high people collecting benefits, that is all recipe for a lot of delays in Social Security processing. I just want you to know that if you need something from the Social Security Administration, you need to be patient. Hold times are going to be long on the phone. If you make an appointment to visit the office, you're going to have to wait longer because there are fewer staff, and then they're going to close offices. So you may have to drive further to find an office that is near you, because all of this is happening as we speak. You can Google it. It's all in the news. So file very soon if you are trying to claim benefits, and double check your documentation to make sure that everything is good, because you may need it. If you unintentionally kicked off the program, you have to have your evidence to back it up for them to reinstate your benefits. And then if you're applying for disability, apply sooner, because it's going to take even longer for your application to go through. So all this is happening to the system, and you can take action. We are not helpless. If you think that your benefits are at risk, you can call your representative, your congressperson, your senator, and let them know that this is not okay, that they need to keep Social Security offices open, that they should, have adequate staffing to process things that seniors need. Otherwise, it's going to be record wait times. And all these cuts that are happening, employees that work for the federal government, their salaries only constitute 5%, less than 5% of the entire federal government spending. So that puts things in perspective for you. That is not where the money is. Everybody that works for the federal government, if you put all the money that they make together, it's only less than 5% of how much the federal government spends. The money is elsewhere, but they're not going to touch it. So let me know what you think. I am going to continue to stay on top of this and bring you updates as these things happening. Things are happening on a daily basis that I can't even keep up, but I hope this was helpful to you. Let me know in the comment section below. Thank you for hanging out with me on this Sunday afternoon, and I'll see you on my next live.